Hey YouTube. So I'm guessing you found my video as you typed in the words hysterectomy recovery in the search bar. I had several surgeries on August the 15th. They were definitely not surgeries that I wanted. I had a total abdominal hysterectomy with a oophorectomy, bilateral. That is where they remove the ovaries. They removed my cervix, uterus, and ovaries. I also had a bladder suspension called an MMK, which is a Marchetti procedure. That is not the most popular as of now surgery for bladder issues. A lot that they're doing now is with slings and meshes, and I also have a autoimmune disorder. I have rheumatoid, and so as my immune system gets turned up and amped up and goes rogue, placing foreign things in my body was not the best option for me. So I opted with that. It's a spinoff of, or actually the Birch method is a spinoff of that. But you can Google that to find out about it. I'm a mom of 3, so after passing several babies through the birth canal, one of which, my first, I was a teen mom. It was a very traumatic birth, lots of injury inside to the pelvic walls. So 22 years later, I'm showing my age a little bit, I needed the repairs. So I also had a anterior and posterior repair to the pelvic floor. I had a very large rectocele, a large enterocele, and a cystocele. I'd probably had those for years and years. You just kind of learn to deal with it. But over the last couple of years, I had increasing pain, abdominal pain, lower back pain, butt pain, thigh pain. And it just seemed to be getting worse. I have a pretty high pain tolerance. I've struggled with migraines for probably the last 22 years, related to food and primarily cycling, menstrual cycle, ovulation, those type of things. So, you just kind of push through and go on with the pain. And I'd had a couple ultrasounds. I had multiple cysts on my ovaries, multiple fibroids. We were just going to keep a watch on them and see, how that goes. I think it was probably 6 years ago when they had first mentioned the words hysterectomy to me. I was not prepared at that time in any way to have any type of surgery like that. So I just kind of put it in the corner of my mind and went on about my day. Probably within the last year, I started having extremely heavy cycles. Hold on a minute, guys. I'm gonna readjust. I'm in recovery, so I'm sorry. I'm so new at this. And so I'm laying down. Sitting at this point proves to be very painful. So, anyways, increasingly heavy cycles, to the point where a super tampon, an overnight pad. I was changing them every hour. My cycles were going on for weeks and weeks at a time. Pretty much my life revolved around my monthly cycle. Still was not ready to have the hysterectomy for, a multitude of reasons. And so I tried other things, weight loss, supplements. Time went on. The bleeding continued to get worse and worse till last month. It got scary. I had called my OB because before we had tried hormone, progesterone pills, progestin, to actually slow the bleeding. They worked once before, so I called them and said, hey, can I get a refill? I'm having some heavy bleeding. He asked me exactly, how it was. When I explained to him, he said, Tara, that just doesn't sound normal. We just come on in. So, I went in and he did an internal exam, and right away he said, this is not good. Your cervix is dilated, and one of the fibroids that was actually inside the uterus, which we had done a sonogram on just a few minutes before to keep an eye on. It was the largest because I had multiple, but it was positioned in the same place where if you were pregnant and you had a baby, the baby would attach to the uterus. It was positioned in that same place. It's also known as a pedunculated fibroid, where it still has a stalk. Anyways, apparently my fibroid was ready for its debut, and it wanted to meet the world and decided to hang out in my VJ. So the fibroid had actually prolapsed out of my cervix. I was, in shock. I'm a nurse. I'm an emergency room nurse. I've been a nurse for many years. I did not know that fibroids could prolapse through your cervix, so I was in shock. But it explained a lot of things. It explained the amount of bleeding I was having. The bleeding was so bad, guys. I had to wear adult diapers. I know. I was at an all-time low. The clotting was horrific. I still feel, even though I've had the surgeries, a little bit of, I don't know, I just feel traumatized. Passing that much blood, and it was very traumatic. He immediately put me on bed rest, wanted to do the surgery right away, but I had also struggled with stress incontinence, urge incontinence, for a while. My urogynecologist also worked together with a urologist, and I had, already seen the urologist, because when they first suggested it, I went and met with the urologist, did everything for the surgeries, thought, okay, we'll have the surgery, scheduled surgery, and then I backed out. This was when we did the ultrasound and found out just how large the fibroid was that was in my uterus. And I canceled everything last minute. He told me, my urogynecologist said, Tara, in 6 months, I'm going to see you back here. I hope I don't see you back here before then with uncontrollable bleeding. Lo and behold, 7 months to the day, I was back. But anyways, the urologist was out of town.